Could we have more information about who's getting the infection? We're told there's community transmission. I know it's low at the moment, but surely we need to know, maybe you guys know, or maybe you don't know, but I'd like to know, do you know, and if not, why not, who's actually getting infections now? And given that we're going to lift things up, lift restrictions, are we going to track in detail? I mean, I asked about 2 months ago, shouldn't we at least know the occupations and the sectors and the categories of people who are getting it so we can understand where outbreaks might be coming? I mean, do you think that's a reasonable thing for us to know, or do we know?
The answer to the first question, do I think it's reasonable? Yes. The answer to the second question, do I know? I would get the same information as you do, Deputy.
Yeah, it's a bit of a problem, isn't it? Infectious control people don't actually know who's getting it. I mean, when we hear young people are getting it, is it young people drinking cans on the canal, or is it young people in direct provision? Do you know what I mean? There's a big difference between those two things, and we need to know them in order to be able to make informed decisions.
Do you want to ask the HSE? Because, I mean, we have people in Committee Room 1.
Yeah.
Do you want, does anybody want to come in from?
Deputy Boyd Barrett, yeah, just come in. This information is assessed as part of the ongoing surveillance by HPSC and discussed at NEFIT, and at their once were daily press conferences, there's information given out in terms of occupation for healthcare workers, in terms of outbreaks, in terms of the background of outbreaks. So there is a lot of information collated by our public health departments on the positive cases, even when there are large numbers of cases. They're not exhaustive to the degree that you say there, that it narrows down to the occupation in one particular place, but they do give broad indications in terms of health workers, age, occupation.
Well, I'm just in my last few seconds. I'd like more information. For example, you know, I've been contacted by hairdressers. They're glad to be going back to work, but they're worried. They're worried.
Contacted one by myself.
What?
I wouldn't mind being contacted by one myself.
Yeah. I had to take the shaver out myself to do this job. But the point is, they're worried about the guidelines. Are the guidelines adequate? How are they going to be policed? But surely one way to test are the guidelines going to work in different sectors is to know, is there particular outbreaks among hairdressers, among transport workers, among people who work in the airport, among school children if we reopen schools? That kind of information surely is critical. Isn't it? Isn't that a reasonable thing for us to know?
Deputy, outbreaks are tracked by public health departments according to where they are. And
for us to know.
Yes, this information is given out, and you'll know about the outbreaks in meat plants, in healthcare facilities, and this information is given out at those what were once daily press conferences by NEFIT, now twice weekly, and there's intense interrogation of those figures by media then, but certainly you also deserve to know, and if there's a report you need, Alan Smith is Deputy CMO here I'm sure will relay that to the NEFIT Secretariat and we'll provide you with any information you need.
So, will the information that Deputy Boyd Barrett's requesting, will that be made available?
I'm sure if any request is put in writing.
No, but as a general proposition, that information about occupation, age, that these sort of things, which in fairness makes a very valid case for, would that maybe be made available going forward?
I can certainly take that back to the Department of Health and NEFIT, and so there's always attempts to try and put across as clear and as detailed as information as is readily available. But certainly I can take that back, yes, and we'll certainly endeavour to make it as freely available